All right. So, of course, I just want to talk to you about a few things that I feel that whatever you feel comfortable speaking about regarding your father. Of course, we're doing the topic on schizophrenia. And Regineak here realized that her father has schizophrenia. So, we're going to talk a little bit about that just to give kind of an idea of what it's like to have a personal experience with someone who has been diagnosed with schizophrenia. So the first thing I'll ask you is, when did you realize that your father was diagnosed or had schizophrenia?
When did I know that it was schizophrenia, or when did I realize he wasn't normal?
Yes, well, answer that then.
I think I always knew that he was different. I always knew that he was different, but growing up, I never thought he had a problem because I didn't really have anyone to compare him to. I mean, I knew his behaviors. I knew growing up that they were a little strange just because of how my older brother, who was like 5 or 6 years older than me, how he would respond to some of the things that my dad would do. But I didn't know that my dad was schizophrenic. I didn't know that he actually had a mental illness until freshman year in college. So I was 18.
Oh, wow. That's interesting. So, because I like that you point out the fact that you didn't really have much to compare to. You just knew this was your father, so that's how you figured fathers were. I guess what I'm thinking is a lot of times there's this idea that schizophrenia is like just a debilitating thing that people will have to be like locked up in a room somewhere, tied up in a mental hospital, or joked up on so much medication that they just sit in a room one day long, staring at the wall. And your experience with your father is that he was still functional?
Functional.
I mean, enough to where he didn't have to be in an institution?
Well, he didn't have to be in an institution over a long period of time to where he wasn't able to interact with us or be a father or be a part of our family. But it was times growing up when he had to be put in the hospital. Maybe sometimes he felt like he didn't need to be on his meds anymore because maybe they made him feel a certain way, or he felt like he was better. And those times his outbursts were more than normal. My dad was never aggressive towards me or my family or my mom. I never saw him hit my mom. I never saw him hit my brothers. He was always loving, but sometimes when he didn't take his medicine or whatever the case was, his outbursts would be a little more aggressive. Like he talked to the TV, so he would spit at the TV. Like if he started being paranoid about something, and maybe a commercial on the TV triggered something for him, he would flash out. He would sometimes knock the TV over, curse at the TV. And I mean, this is when me and my brothers would be just sitting down watching TV and up in the living room, and he would come up in there and do something. And those times my mom felt like he needed to be in the hospital because he wasn't taking his medicine. Yeah. And when that would happen, she would just call police. And it's been a couple, maybe like 2 or 3 times that I can remember the police having to come to our house to take my dad, and my mom being on the phone with like the 911 lady saying and her telling my mom like to hide the knives and just things, and it opened my mind. I didn't understand what was going on. I just knew that something wasn't right, and it opened my mind a whole lot because I never saw my dad as being an aggressive type of man. So whenever I saw my mom like trying to hide knives, it made me wonder: was there something I should be worried about, or did he have the potential to hurt us? Because I mean, he would sleep with an ex next to his bed, and my whole life he did that, and not once did I ever think that was abnormal. Not once. He would take a chair and put it underneath the door, just in case somebody may have tried to come and like rob us or whatever, hurt us in our sleep. But he did all that, and I never thought he was aggressive.
Yeah, and so you were never really scared. Mm-hmm. I guess the last thing I'll ask you too, as this is an introduction to what we're going to talk about. Well, I've heard people talk about this before, but do you think did your family know that it was schizophrenia? Did your mother know it was schizophrenia? Like when? How did they go about realizing that, or at what point did it become diagnosed or clear?
To be honest, I've never really sat down and had a serious conversation with Mom about like at what point she knew my dad was schizophrenic or anything like that. So I really don't know if she's even. I know that she knows that he has schizophrenia, but when she realized he had that illness, I'm not sure.
She could have known all along.
She could have known all along, yeah. Or, I mean, I just don't think that in my community, speaking from my community, I don't think that there was enough resources for our family to help better, like, help my dad with this illness and to help keep our family together. Thankfully, our family never split up until Hurricane Katrina. But before then, my dad has always been in my life. Since the moment I was born up until he passed away, he was always there. So I think that a lot of that was because of my mom just wanting to keep us together. My mom kind of took on the role as my dad's mom, like he was her other child. So she made sure he was safe. She made sure he had things to occupy his time because he wouldn't leave out the house. He would never leave out the house. And she made sure that he had everything he needed inside of the house to make him comfortable. She even made locks on the door to where he couldn't get out. If we were not there in the house, he couldn't get out of the house. And I mean, looking back, that's not really safe because if there was a fire or something in the house, then he's kind of stuck.
Sure.
I mean, we had a balcony. If he felt like he wanted to jump off the balcony for some reason, that could have been something he did. But I mean, just leaving outside of the house, he couldn't do that. And once again, it like really it blows my mind because I never thought that there was anything outside of normalcy for my family. It's how I grew up. It was how our family was, and I mean, it worked out for us. It worked for us.
And see, that's the thing that I think last thing I want to touch on, what you just made me think about, is that how it sounds to me like your mother. It took a lot of her to be able to do all of that and still take care of your father. And I know that a lot of people may not always be willing or even understanding enough to be able to handle that or know how to handle that. And I think that brings me back to what you were saying about the lack of resources that there is in the community. Do you think that made a big difference? Or that it does make a difference from what you've seen? How it affects it? I guess I should ask, how do you think that affects it?
How do I think?
The lack of resources, what would be different if there was?
I think that if there were more resources in our communities about mental illnesses, I think that a lot of our families wouldn't be as broken up as they are. I think that we would just have more assistance in areas that we need, because a lot of times I feel like when we see somebody that's acting strange, it's normal for us to say, oh, they're just being crazy, or they high, or they're on drugs, but that person might actually be going through something that's deeper than just doing drugs. Drugs may be their way to cope with whatever is going on through their mind, or to calm their mind down, or suppress those emotions that they have. So I think that if we had resources in our communities, or people coming out to your doors, just informing us, we would be better informed. So our response to those things would be a whole lot better.
Yeah, because you would be more informed. You would know what to do.